What is a shoulder subluxation and how does it differ from a shoulder dislocation? We'll discuss that in this video, as well as what treatments exist to help you recover and return to the activities you love to do. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, most people understand in theory what a shoulder dislocation is. Basically, the ball, let's show that here, the ball pops out, or see, the ball here pops out of the socket. Basically, it, from a variety of different things, usually sport or a fall awkwardly, the ball slides out of the socket completely. And especially if it's the first time you've ever done it, you have to have it put back in place by another person. A lot of times you need to go to the emergency room and have that done. Very, very traumatic injury. And there's a lot of issues with that down the road. And in younger people, very, very often that ends up needing to have surgery down the road. A shoulder subluxation is a milder form of that same injury. You still get the ball to slide compared to the socket, but it doesn't go all the way out. It gets maybe part of the way out and then sort of pops back in on its own. And so a lot of times it's not severe enough that you necessarily think much about it. But again, you notice it, especially that first time that it happens. It's still an instability event, but because the ball's not completely coming out of the socket, maybe you don't tear the labrum, the cartilage bumper along the socket, or the capsule that holds it in place. Now, sometimes you do. It's enough of a slide forward that you do have labral injury or you do have capsular injury. And that's why sometimes shoulder subluxations need surgery. But before you get to that point, you go to the doctor, especially if you're saying, hey, my shoulder feels loose, it feels like it's sliding around. A lot of times by exam, they can see, especially compared to the other shoulder, it feels looser, the ball's sliding around in the socket a little bit more. Maybe that orthopedic surgeon would get a specific type of MRI called an MR arthrogram that can help show a labral tear or capsular injury that might suggest, hey, this might need surgery. But it may also involve, again, because it wasn't a full dislocation, maybe you can get better rehabbing it. Physical therapy, extremely important to do that. Strengthening the muscles around the shoulder, the muscles off the back of the shoulder blade, and that can help you get back to 100% a little bit faster. Big, big fan of physical therapy. But in people that it is unstable, and maybe if there is a little bit of a significant labral injury with it, even though it wasn't a full dislocation, sometimes surgery to treat the instability is important. Reattaching the labrum to the socket, tightening the capsule, that can be done arthroscopically in most cases to stabilize the shoulder. Now, that recovery from surgery is a long process. That the surgery is outpatient, but it's a lot of work protecting it, 3-4 weeks, sometimes more, to get the repair, the reattachment to heal, but then working with a therapist to get the motion back, to get the strength back, to get the functional ability overhead and whatever it is that you do for your sport or exercise or work, to get that back. It can take many, many months, sometimes 6, 9, even 12 months for that to feel normal, or at least the way it did before the injury. But it can have very good success rates. Could some of the regenerative treatments, the peptides maybe, or regenerative treatments like PRP or stem cells or exosomes, improve the healing? Potentially, depending on what it is. Peptides, maybe they speed the recovery, strengthening the tendons and ligaments and getting the muscle stronger. Maybe that speeds the process. Maybe the PRP or the exosomes, or increase the healing of that repair, the labral reattachment in the capsule. Those are experimental or used off-label. Not promoting those. Just get a lot of people asking me about those. And so I feel like it's worth addressing at that point. But shoulder subluxation, if you feel like the ball is sliding out of socket, again, this is not medical advice, but if it feels like it is, but maybe it's not going all the way out of place, seeing an orthopedic surgeon, finding out the extent of the injury and what to do about it can be a very, very helpful thing. Now, I'd love to hear about your experience with your shoulder injury. Leave those in the comments below. Just understand, I can't offer you medical advice, but I will try to answer your question in a future video. Please subscribe to my video channel. Click the bell to be notified when I release a new video and when I start another live stream like my Ask Dr. Geier Live shows. If you have a shoulder injury or shoulder pain, or maybe it's pain of your knee or your hip or some other bone or joint pain, and you want to get significantly better in the next 30 days without cortisone shots or without surgery, learn more about working with me in the description below this video. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.